Heterotopic ossification is the formation of extraosseous lamellar bone in the soft tissue surrounding peripheral joints. It is especially in persons with prolonged immobilization, that is, spinal injury, burn, stroke, and TBI, loss of ROM, joint swelling, fever, pain, and ankylosis. Spinal cord injury more common around hip and medial aspect, knee, elbow, shoulder, rarely small joint of hand and foot. Lateral medial aspect around hip 3 to 12 weeks at peak at about 2 months post injury. Risk factor severity of neurological injury, male more than female, younger age, although less frequent in children and adolescents, presence of DVT, spasticity, pressure injury in close proximity to the involved joint, presence of DVT, spasticity, pressure injury in close proximity, UTI, pathogenesis not completely understood, potential mechanism, inflammatory cascade, dead and dying soft tissue, immune cells, release of cytokine and growth factors, stimulate fibroblastic proliferation and collagen deposition at the soft tissue site, local myelohypoxic release of endogenous factor, formation of mesenchymal and osteoprogenital cell clusters, differentiates into chondrocytes, hypertrophy and rapidly divide, secrete cartilaginous matrix, angiogenic factor and microvascularization, increased tissue oxygen tension, osteoclastic differentiation, decreased mineralization, remodeling of the woven bone and mature laminar bone, eversion canal, marrow cavity, blood vessels, remodeling of the woven bone, osteoblastic differentiation, initiation and propagation of HO, resistant tissue, macrophage activity, release bone forming factors, BMP2 and oncostatin M. BMP2 and oncostatin M. Long-term complication of HO are loss of function, difficulty sitting in a wheelchair, chronic pain, pressure injury, DVT, increase in spasticity, nerve entrapment, recurrence after surgery. ADRHO, lower extremity fracture, DVT, septic arthritis, cellulitis. Blood investigation करेंगे तो CBC, ESR, CRP to rule out the infection disease activity. Non-specific marker for HO, ALP. Earliest laboratory indicator is ALP. Precedes radiographic finding. Serum creatinine phosphokinase secretion, urine excretion of hydroxyproline and collagen metabolites. Indirect marker of HO. Radiography में triple phase bone scan is most sensitive before calcification become apparent on plain radiograph. First, second में hyperemia and blood pooling. Third में calcification.